Hello, my name is James Donnelly. I'm with Safe Haven Insurance, your Medicare and health insurance safe place. I'm here today. I'm at the American Waffle House in Seaford. They're sponsoring our podcast today, so I want to say thank you to the American Waffle House of Seaford. Food is great, family-run business. I'm sitting here today with a very special guest, Ilena Corina. She is a board-certified patient advocate, and she is the president and founder of Pulse. So I met Ilena in a networking group, and she always talked about patient advocacy, and I know how important it is because when my grandparents were in the hospital, my mother, she was there at my grandparents' bedside 24/7, and she advocated for them, for their best care, and she was there. And when my dad was in the hospital, we did the same, and we honestly feel that my dad wouldn't be alive today if we weren't there 24 hours a day by his bedside advocating for him. So Ilena's story touched me. She is the founder. Ilena, welcome to the show.
Thank you. It's great to be here. And yes, I love the Waffle House.
So tell me about your journey and how you came about finding Pulse and getting it started. So.
Well, my journey is very personal, obviously. It started in 1990, actually, when my son, who was not yet 3 years old, had a tonsillectomy. And following his tonsillectomy, he started bleeding. And for a week, he was bleeding until he died from blood loss and infection. His body was full of infection. So as horrible as that was, I also had another child who was severely premature a couple years later. First I had another son and then a third son. And my youngest son was very premature. And we spent 5 months in neonatal ICU with him. And I saw how wonderful the care was. So I like to think I saw the worst of healthcare, but I also saw the best of healthcare. And I realized that when my first son died, nobody asked me what I could have done differently or what could have been done differently. It was all about lawsuits. It was all about being angry. And I really felt it was very important to learn from what happened, and nobody was going to learn from that. So we started a support group. I met people.
It's a horrible story.
Yeah, and I met people who also lost family members. One was a nurse, one was a doctor. And we realized that people didn't want to hear what we had to say. So we started a support group in a congregation in Freeport. The South Nassau Unitarian Universalist congregation hosted us as a support group, and it grew and grew on a Sunday afternoon. And we realized if people told their story in a way that wasn't negative, as upset and angry as they were, we could learn how to improve the healthcare system. And one of the first things we did is we lobbied for New York State physician profiles to get access to information on doctors' backgrounds. Not for good or bad, but just to become a tool to become an educated consumer. And then I went on boards, national boards, the board of the National Patient Safety Foundation, which was founded by the American Medical Association because of the rising concern of medical errors in the country. They're now the third leading cause of death in the country. And then I became...
Wow, that's the third leading cause of death.
Yep, that's what they say is the third leading cause of death.
I heard at one of your trainings you said it's more than cancer. What were the statistics? There's
cancer, and there's I actually forgot the next few of them, but it is the third leading cause, and I think one of the reasons that we don't hear about it is because it's not grouped. There's no grouping of medical errors. There's so many different types of medical errors. So we talk about diagnostic errors, medication mistakes, infections. They're all grouped under medical errors and unplanned outcomes in care. And to avoid that, I think we have to talk about it. We have to encourage people to be part of the healthcare system and not going in without the expectation of expecting it to be 100% every time.
And I'm sure it's hard for hospitals and healthcare facilities and doctors and nurses to admit when there's an error. So it's almost like it's like a denial kind of thing. Do you feel that, or?
Well, yes and no. I think
Okay.
it's nobody wants to admit. You know, you get in a car accident, for instance, and the person who hits from behind says, "Well, you stopped short," and has all these excuses. But the fact is that there's insurance. If you have the insurance, you do what you have to do to fix the car, repair the person, and we all take care of it and we move on. In healthcare, it could be very complicated because they thought they did something right. Now, we're not talking about criminal, we're not talking about incompetent care, we're talking about basic human error that happens very often because it's so complex, the healthcare system's so complex.
And that's how you learn. You learn from your mistakes, and you have to kind of own, and I was taught very young, you have to own your mistakes, and then that's how you grow. So do you find that medical professionals and facilities have an issue owning up to their mistakes?
Well, there's a whole movement of, it's called disclosure of a medical error. So when something goes wrong, the senior leadership comes out and wants to talk to the family and talk about how they're going to compensate the family and fix the problem and everything's going to be wonderful. But I think what we have to fear is that people run to their attorneys first, and that closes everything down. And we have to have a system better prepared for medical errors, what to do when something goes wrong. Like insurance, you pay the insurance, you meet the family, you discuss what went wrong, you tell them how you're going to fix the problem. When I hear people say, "I want to make sure this never happens again," well, a lawsuit's not going to change the system. Education is going to change the system to explain what you lived, what you learned, and then move on from there.
So now, what does the group do now? What is Pulse? What do they do?
We do so much.
Okay.
So, well, we're now virtual because after COVID, but we did start off with as a group, support group, and then
in a church.
In a church.
Okay.
Yes, in a church, and then we moved into programs. So when I started going to conferences, I go to a lot of medical conferences, and I've learned I want to share what I've learned. So we started People for Patient Safety, a group of people that we were meeting in a diner, and we would talk about what we learned and what we know. And there were nurses and doctors and community members that would come together. And it's important to know that our focus is very often on the community. You don't have to be a professional, but we need professionals to help us understand, a pharmacist, a doctor, a nurse. So we started meeting, and that was People for Patient Safety. And then we have, now it's virtual. It's the second Monday of the month. Then we have the PAC, Patient Activation through Community Conversations. The PAC is a discussion group that was also started, meant to be sitting around a table with a group of people, choosing topics you want to talk about, 50 different topics, and then we talk about what your experience has been and what others could learn from. You know, I usually start my presentations with what is appropriate exam for a 4-year-old girl? Nobody knows because we're not talking about it. But what is your experience with your 4-year-old daughter? What was that exam like? And let's talk about what we should expect. And then we also have our final program, ACEs, Advocates Collaborative Educational Series, and that's a lecture, case studies, and a discussion. And 2 of those programs are now continuing education for board-certified patient advocates. They're all virtual, they're all free, so we want people to come and be part of it.
Well, I had the opportunity to sit in on the discussion. What was that called?
The ACEs?
No, not the ACEs. But
the PAC. That was the PAC. Yes.
And I have to say, it was so informative and it was so nice. It was just a casual discussion. We picked a topic, and everybody talked about their personal experiences, which was really nice, because this way here you kind of know what other people are experiencing and how they handled it, and how it should be handled if it was the right way, if it was the wrong way. So it was very, very informative. It was great. I'm looking forward to the next one. And then ACEs, I actually, Eileen invited me to do a lecture on Medicare and, Medicare 101 and explain Medicare. And that was really great. And I had the opportunity to go through your library. She has a video library online for all the ACEs presentations. and they're really so informative and amazing. So I really appreciate that.
Well, we really want people to learn from what we offer. I mean, Medicare is one of those really scary pieces of the healthcare system that people are not familiar with. It's just an example of one other piece of what we don't know. We don't know what we don't know. And if you can help us understand what we don't know, then it makes it easier. And then putting a human behind that so we can call and ask questions.
Always. My phone is always open for you, for anybody, really. I really love what you did and how you founded this group. It's very sad how it all came to start. But now, are you still local, or because you started in a church, you said in Freeport, right?
Well, we've been on Long Island for all these years, but ideally we're now virtual. So everything we do is virtual. For years, I would meet people in the hospital. For 20 years, if I got a phone call that somebody's not is nervous about their care, because everything we do is safety. It's not, if you don't like the looks of somebody, we're not going. But if you feel unsafe, we want to step in and have the conversation and make sure that the family feels safe, or the patient feels safe, and the family has a support system. So what we do, because we don't charge and we're all volunteers, is we work with the family that wants to advocate for the patient.
Okay.
So like you said, you had family members with your father. If they were concerned and didn't know what to do, then I could spend time with them and talk to them about how to advocate, who to call, who to speak to. Maybe I can make some phone calls for them, and do some reach out, and then reach out to the larger community for them. So if they have members of a church, or they have people at their job that want to help, but people don't know what to do, I can actually reach out, or one of our volunteers could reach out and help the patient, help the family, help the patient.
So that's what Pulse does. Pulse is a resource for people who feel like they need patient advocacy.
Yes, yes, but we may not do it, but yet our training, what we do, our family-centered patient advocacy training, is training people to become advocates for family members and have some idea of the system, the healthcare system.
Okay. Now, your title, you're a board-certified patient advocate, right? It's pretty impressive, actually, because I know what's involved. I've learned what's involved in the training process, because Eileen invited me to a training. It was so informative. It was a 2-day training, and I got a certificate, right? As a certified, what am I now?
A family-centered patient advocate.
Okay.
Yes.
But there was people there that were board certified. So what's the difference, and what do those people learn, and how do they help others?
Well, board certified means that you passed a test.
Okay.
I passed the test.
Okay.
A lot of questions on Medicare were on the test. A lot of questions. It does not mean that you have the qualifications to work with people. The family-centered patient advocacy is about patient safety, how the system works, and actually acting out and doing the training that you want to be part of the healthcare system. So that's the difference. It's on hand. We're probably going to be doing it virtually coming up. We want more people to be trained.
The board certified part?
No, the board certified is strictly
the patient safety.
Yes.
Okay.
Yeah, the family-centered patient advocacy is a certificate that says that you have passed the test on safety and communication. It's mostly communication. I think you might remember that.
Yeah, yes.
Yeah, and that's a big piece of safety, is how to ask questions.
Well, so many people feel like they're speaking to a doctor or a nurse, and they're more educated than them, and they feel strange questioning them about their knowledge and about their advice. But in actuality, it's our right to be fully informed and make conscious decisions on our own, and not just go by what somebody's telling us, correct?
Yeah, absolutely. And I like to use the example, I don't even think it's far off. I worked for 20 years in the post office in the front window, and when somebody came in to mail a letter, my job was to explain to them the services. If they didn't understand it, I could explain it again. So when I talk at medical conferences, I very often ask the doctors or nurses in the audience, who knows the difference between registered mail and certified mail? Nobody does.
Yeah.
Nobody does. And if they want to talk to me later, they can tell me. I can tell them. But the idea is that was my job. So if I don't know the difference in an MRI and CAT scan, it's my doctor's job to tell me, or nurse practitioner or physician's assistant, whoever's treating the patient, to explain to the patient what they want to know about their medical care and treatment. So It's also important to remember Pulse is not about your health. So if you don't eat right and exercise, we're not getting involved in that. But we want you to tell your doctor and your medical team, because it's important for them to know. So our journey is the journey to the best outcomes in the health care, not necessarily your health. So we want people to have that communication, be able to help get a diagnosis, know their own medications, know their own medical history, and not go into the doctor's office and say, I don't remember my medication, because you're opening up for mistakes. And then if the doctor starts prescribing stuff that may counteract with something you're also already taking, or prescribing stuff that is for a medical condition that doesn't exist because it's your medication causing the symptoms, we're causing our own problems in healthcare.
So part of the reason why I got into Medicare was because there was such a lack of knowledge, and a lot of decisions are made on fear, or because someone was telling you in a hospital setting or in a nursing home or in a skilled nursing facility, hey, this is a better plan. And my clients were making decisions based on fear. So I felt compelled to really learn as much as I can about Medicare and get certified and teach my insurance clients about Medicare. And now I'm like on this mission, and I do seminars, and I want to speak as much as possible because I'm passionate about it, because there's so much misinformation out there. And our story's is similar, but different fuels to the fire. Like my grandmother, they switched her plan. I mean, it's no comparison. Your son passed away, that's a tragedy. But you took that tragedy, and it fueled your passion. And now you're helping thousands of people, tens of thousands of people across the country with this. Now, with your conference, your patient advocacy training, I found it so informative. I was there for 2 days. It was really great, and I would go every year to that. I really would. So you're not doing it live anymore? You're going to do it virtual?
Well, we need sponsors. If we're going to do it live, it's not inexpensive, and we don't want to charge people such a large amount of money that they can't attend.
It was very reasonable.
So it was reasonable because we had 2 major sponsors. And we can't seem to get grants because we're not grant writers, but we're looking for sponsorships. So if we could get the sponsors and put this together again, in a heartbeat I would do it. It's my favorite thing in the world to do, because I learn, because it's so interactive, I'm learning from the people who come.
There were so many speakers there that shared personal stories about tragedies, again, that fueled their passion, and that's why they're doing what they're doing. But it was so informative, and I really got so much out of it, and it wouldn't be good if you didn't do it anymore. So I want to advocate for you to do this training, and I'm going to help you. And that's why I got involved with Pulse, and I'm on the board now, because it's such an amazing organization. And I don't know enough about it to speak about it. I've tried a couple of times, and I'm really off, but I'm going to get there. And that's why I wanted you on the show, to tell your story and explain what Pulse is. How could people help Pulse? How could they help this nonprofit and help you advocate and be there for patients?
Well, we don't have, we have volunteers, we're all volunteers, and we now have somebody who does the website and somebody who does our academy, which is what you talked about, the videos. So we have people helping in areas. Having people come to our programs, especially the 3 a month that we do, having people come and share their stories and their experience, I think is tremendously helpful. Of course, we would love donations, and we need funding and help with fundraisers, but bodies in the room is really what's important, because if I go into my doctor's office and they don't expect me to talk up, then it hurts everybody. So we want people to be more active. It may not even be this generation. It may not even be my generation. It may be the next generation, and I'm okay with that. But if we can never stop encouraging people to be more involved in their care, and the way they can do that is getting together, meeting people from around the country that also have the same passion. Remember, we're not there to badmouth the healthcare system. We're there to become educated. We do have rules when they come to our meetings. We don't give advice. I'm not going to tell you this is what you should do. I'm going to tell you this is what worked for me. because we don't want people we're not giving advice. We're not there for advice. We're there to share our stories. We are not allowed to badmouth the healthcare system or the doctors or the system. It's all positive. And we also encourage people to make friends and get support. So when somebody was having hip surgery recently, I know he exchanged phone numbers with somebody in the other part of the country that also had hip surgery, and they wanted to compare notes. So we want people to build their support through our groups and not be afraid or not feel intimidated because they're part of a healthcare system that they don't understand. None of us understand it. And nurses and doctors very often feel the same way. When they become patients, they're very vulnerable and they need support and help too.
Okay, so in order to attend and get in these rooms, do you need to be a member?
No.
Also, you don't?
Anybody.
Okay, so how do they find out? How do my listeners find out about these meetings that you have monthly? Because you have several meetings a month.
There's 3 a month, It's on our website, pulsecenterforpatientsafety.org. And it's
pulsecenterforpatientsafety.org.
Right,
Okay.
and it's under programs.
Okay.
And then we have a listing of our programs, which is the academy and also our training. We also now, after the training, like yourself, are listed on our website as family-centered patient advocate trained people, because we want people to call. We've never done that before, but we're encouraging people now to reach out to the people who have been trained. And also we have a membership, which is new. So the membership is $55 a year right now.
$55 a
It's
year,
$55.
which is nominal.
It's
Yeah.
right, and you get 2 free videos.
Okay.
You get to watch 2 free videos for continuing education or not, and we get a lot of perks. You get discounts and stuff for the
So
membership.
who would fit the criteria to be a member?
Anybody.
Anybody.
There's
Okay.
nobody that we would not want. We want grandma, and I encourage our speakers. I don't know if you remember when you did the Medicare. I always say pretend grandma's in the room, and that's who you're talking to. Sometimes we encourage do your presentation in front of a 12-year-old. Make sure they understand it, because we don't use acronyms, or if you use acronyms, we make sure that one of our volunteers is watching and putting it in the chat, because we want everyone to feel welcome and learn from this and share their experiences.
Okay, so membership. They could go on your website and become a member. Which is $55 a year. Is nominal. It's not a lot of money at all, and they have access to 2 videos a year, all the meetings,
Absolutely.
and discounts also.
Yes.
Nationwide discounts, local discounts.
Well, everything's virtual, but when they came to the
nationwide
training,
discounts. Okay, that's great.
Yeah.
Now, this is, Eileen brought this. So tell me about this. This is pretty cool, because you guys spoke about this at the conference as well. So what is this?
Well, this is one tip of what we do is we not only tell you what you should do as a patient or what works for us, but here's proof of here's what medical professionals say we should be doing. So hand washing is an obvious.
It's obvious, right?
It's an obvious.
Yeah.
So healthcare workers are supposed to come in and wash their hands. They touch the doorknob, they touch the clipboard, and then they come over to the patient. And sometimes even with surgery, they'll come over to a patient after they had surgery to change the bandage and not wash their hands. They put gloves on, and they could absolutely use the hand sanitizer.
Okay.
But we wanted to do something to show that they're going to clean themselves. And in the hospital, you get things like C. diff, which is an infection that doesn't come off with the antibacterial. It has to be hand washed.
Okay.
So instead of saying to somebody, "Could you wash your hands?" and then they say, after years of doing this, they'll say, "I did already," and then you say, "Well, could you do it again?" and they get mad at you. We started doing, would you do it again for a Twizzler? Okay. And it could be anything. I have, Mounds, candy bars too. Would you do it again for a Twizzler? And it says, "Thank you for washing your hands. Please help yourself to a Twizzler as a thank you." So even a surgeon who has come over, went to the patient to touch the patient, check her bandage, check her wounds, and I asked him to wash his hands, and he said, "I did already." When I said, "Would you do it again for a Twizzler?" he laughed and said, "Of course." And he's washing his hands, and we gave him Twizzler. And sometimes you'll see in their jacket pocket Twizzlers. If I use, these are the short ones, but if you use the long ones, when I'm waiting for somebody in the operating who's going to get an operation, I've seen them walking around with Twizzlers after giving them a Twizzler. And if they say they don't want one, they don't like them, they don't eat candy, give it away to somebody. But please go wash your hands and help yourself to a Twizzler. Recently, I was in the hospital visiting somebody, and we had candy, and it wasn't Twizzlers. And I said, "If you get the patient her discharge information, you're welcome to candy." She says, "I'll be right back. I'm not even a nurse, but I'll be right back." So it really made it very light. It's a light way of, we're accusing them of not doing their job in reality.
Simple things.
But we're making it, right. and to make
Which
light
could
of it.
spread C. diff
Right,
and other
absolutely.
infections. So a simple thank you for washing your hands. Please help yourself to a Twizzler. Thank you. So this is just an amazing idea. So if you have anybody in the hospital, give them a cup with some candy and motivate the nurse, the surgeon, whomever, to wash their hands one more time for you. Because a lot of times it's uncomfortable. We don't want to ask, and we wonder, did they wash their hands? So it's something as simple as a Twizzler or just asking. And people are uncomfortable doing it, and that's why communication is huge.
It's huge. It's huge, and we don't have to feel intimidated. We don't have to feel, angry. But I take care of somebody now, and I go into the doctor's office with my wipes, and before they sit on the table, I wipe down where the paper isn't on the seat, and I wipe it down, and I wipe down, and I call up the clean wipe campaign, because I'm trying to wipe down these doctors' offices, and they're filthy. I haven't been putting it on my social media. That, oh my God, I can't believe how dirty
how dirty the wipes
are. It's amazing. And I brought it to office managers, that your office is really dirty, and they don't.
But it doesn't look dirty because they have cleaning people that come in and I always said, like when my kids were in pediatrician and we were in the waiting room, I'm like, don't touch anything. And it's the truth.
Yeah, and I try not to think of myself, I joke around about being a germaphobe. I'm not a germaphobe. I try to set practices. If I'm going to do it, if I'm asking other people to do it, I'm doing it. When I go to the doctor's office at 9 o'clock in the morning, they say the cleaning crew was here last night. It's 9 o'clock in the morning. Why is it so filthy?
But how many people are not comfortable enough to say something like that and say,
well, I'm not comfortable. I don't want to do it.
So it's like silly things that we take for granted, that most people take for granted, that the doctor or the nurse wash their hands, that the doctor's offices or the hospitals are wiping down and disinfecting things that people touch every day. These are just minor little things that could make a huge difference. And it all has to do with patient safety and us being advocates for patient safety. Washing your hands, wiping things down. I mean, it's so silly, but it's more involved than that. Those are just the basics.
It's a start. It's a start.
But again, we're not comfortable doing it. And being a part of Pulse and sitting through some of the meetings and going for the training just helps you get a little more comfortable in advocating for safety. I mean, that's what it's all about, right?
Yeah, and if you also think about it, as we all get in the car, we know we'll just stop at the red light, we go on the green light. Imagine if only half the people knew how to drive. And you're getting on the street with people who don't know how to drive. When we go in the hospital, we all have to know the same information. We all should know the same information. When a plane crashes and 200 people die right away, that's big news. But when people are dying around the country one at a time, then it's not big news because people aren't hearing about it. But if everybody died at the same time...
That's a pretty scary number, though. You said that more people die from medical error, right?
Yes.
Medical error.
Yep, medical errors.
Than cancer, heart attack, and stroke combined?
Well, cancer's number one, I believe. I don't even remember the other ones now.
Because we spoke about it at one of the trainings.
Yeah, I'm actually not thinking right now, but it is, they say the third, 250 to 400,000 people die every year from medical errors. That's Johns Hopkins study in 2016.
That's a high number.
It's a very high number. Yeah. And that's not including injuries.
And it's not talked about. You don't hear about it. Because like you said, if that many people died in one shot, it would be all over the news. But it's little drips every day, and it's not discussed.
Right. And when we talk about it's not my numbers, this is studies, research, government funding is going into this research. So it's not like I'm making this up anywhere. And we have on our website, we have the One is a Number campaign. So you could look up a lot of these statistics. They're research, they're government funded studies. So this isn't just made up. And the reason I have One is a Number is when I asked a hospital administrator once about funding, telling him how hard it is for us to be funded. He said, well, if you show us numbers, then we can maybe find you some funding. I said, if it's your child that dies, is one a number? So if we could save one child, is one a number? And how could you think that we're not going to save lives if we understand that there's a problem with the healthcare system? We put on our seatbelts before the airplane takes off. We know where the emergency exits are. We learn all this before the airplane takes off. So when I look at the Miracle on the Hudson that happened over 10 years ago now. Right?
Was it? Wow.
Yeah, I remember I think it's over 10 years ago. I look at that film, the video of all those people walking off the plane, And one person got the credit for that, the pilot, for a safe landing, which was wonderful. But those people got off that plane safely because they got off themselves. They knew what to do. They knew where the flotation devices were, and they knew how to get out. So that training helped them. We have to credit the people who got off that plane, the passengers. We could be doing the same thing for patients. If they knew more about what to do before they get in the hospital. Remember, we're going to learn when we get in the hospital that we have to have the healthcare proxy form. Well, what good does that do when I get in the hospital and I didn't talk to anybody?
I just spoke about this on my last podcast.
Yes, and that's why it's so important to think about it and talk about it and do it before you get in the hospital. I've been an advocate for someone at the bedside. They'll ask me to be their healthcare proxy because somebody has to be, and I don't even know them. So how can I have that conversation with them about, well, do you want experimental treatment? Would you want to go on a ventilator? Tell me something about what your wishes are. If I have to speak for you only through your surgery, because I'm not going to stay somebody's healthcare proxy if I don't know them. Yeah. But we have to do that before we get in the hospital. At 18 years old, a child leaves home. They're an adult. You cannot speak automatically for your children if they're away from college. They get drunk, they're unconscious, the hospital is going to call you, and you're going to call the hospital. You're not going to get information. They're 18 years old.
Being a part of Pulse is just like why I got into Medicare. It's planning, it's knowledge, right? So I want my clients to have as much knowledge as possible before making a decision. My last guest was John Zenner. He was an estate planning attorney, all about planning. And
He still is.
No, he is. It's all about planning and preparing for those events, because why would you wait until an accident happened or someone died to try and clean up a mess? Being a patient advocate, why would we wait? Why would we wait for my dad or my mom or my grandparents to go into the hospital before we needed to know these things? So being a part of Pulse is kind of preparing and learning for those things that may and most likely will happen, because let's face it, somebody that you love and know is always going to end up in a hospital eventually, at one point, at one time. Why not have as much knowledge as possible about guiding them and making right decisions?
Exactly.
Okay, so one more thing. What is this Take Charge campaign?
All right, Take Charge, we're actually going to be training ambassadors. The Take Charge campaign is 5 steps for safer healthcare. Okay. And the purpose is that we have...
I don't have that in front of me.
We have realized that these are the basic 5 steps that people should be taking when they enter the healthcare system, and to prepare, actually not when they enter, before they enter.
Okay. Planning, preparing.
Exactly.
Okay.
So studies have shown to understand and complete your advanced directives, specifically the healthcare proxy.
Okay.
And
which we just spoke about.
Right.
Okay.
Yeah, I don't make this stuff up. We've been working on this. Keep a record of your medical history and current medications. So if you had a broken leg at 4 years old and you had surgery, they're always going to ask you, how many surgeries did you have, or what was your surgery? Have your medical history. You don't want to go in the hospital and say, I don't know. Prepare a doctor's visit. Make a list of questions. Don't waste your time in the doctor's office. Do you need a flu shot? Do you need to get test results? What are your questions for the doctor? Prepare a list, and it could sit months until your next visit. And then prevent infections, ask caregivers to wash their hands. And then number 5 is use an advocate and be an advocate for others. And what this started as, in March is Patient Safety Awareness Week, the second week of March every year. And that's when we kick off all 5 steps. Every month we focus on one of the steps through August, and then September is Patient Safety Day with the World Health Organization. So we kind of wrap it up that way. But we want people to do this all year. And we're going to be starting a training facilitating the Take Charge program. We could do it in high schools. It would be great for seniors leaving high school, going into college. These are all things that they should be doing. And actually, students of public health helped us develop the program. And they didn't even know what a healthcare proxy was. They didn't learn that in college. So we're going to be training people to do this, go out in the community and teach the 5 steps, learn from the people who you're sharing with, and help them understand how important this is.
So basic planning and knowledge, I mean, that's what it comes down to, so that's great. So if any of my listeners wanted to help or be a part of Pulse, again, what's that website?
Pulse Center for PatientSafety.org.
Okay. And then they could donate, right? And
Absolutely
help.
right on the website.
They could donate on the website?
Donations are really helpful for our programs. We do have a budget because we have these programs. It costs money to run the website and do the programs. So we definitely need donations. We have, in September every year, we do a comedy show, which is a fundraiser, a lot of fun.
It's coming up a couple months. It's September what?
15th.
15th?
Yeah.
It's right here in Belmore at the Brokerage Comedy Club.
Yeah, we don't want to date the show, though, so it's 2024.
Okay. 2024, yes, exactly.
But we want people to come to our programs because the more people that feel educated, once you start asking your doctor to wash their hands, it's easier for me to do it. So we just want everybody to do it. Maybe they'll just start doing it without having to be told.
And what about sponsors?
We want sponsors. We have a sponsorship program. So we love to advertise our sponsors, give them the floor, and give them put them up on our website. We definitely want sponsorships because if we can't, that's the way we can give back.
And so how do people contact you if they wanted to sponsor you or donate or be a part of Pulse or get more involved? How do they contact you?
They can email me at icorina, ICORINA, at pulsecpsea.org.
Okay.
Or they can, info at Pulse also is on the website. Somebody will respond to them there.
Okay, great. Thank you so much for coming on. I really appreciate it. I really wanted to get your message out there because it's so important. And that's what I do is I work with seniors, anybody on Medicare, or frankly anybody who has health insurance. And I just want people to be empowered with knowledge. Mm-hmm. And when I met you and I went to your training, I felt empowered. And I believed in what you believed in, and that's why I volunteered to be on the board because I wanted to help get the message out there and help Pulse grow. So thank you so much for being you. And I'm so sorry about your tragedy. It's heartbreaking, but you're saving people across the world, and you're really doing an amazing job. So
and you are.
Thank you so much,
too.
Ellie. I appreciate it.
Thank you, James.